See 2-year-old's incredible transformation after surgery to remove facial tumor. On her third day of life, Sloane was transferred to the hospital's neonatal intensive care unit, or NICU. It turned out that the growth was a tumor. Luckily, it was non-cancerous, but doctors remained very concerned. Her parents, Joe and Jennifer, meanwhile, were left reeling in shock. Fortunately, the medical professional in charge, Dr. Hardy, was extraordinary. He became an essential part of Sloane's life for a long time. He walked into Sloane's hospital room when she was just born, looked at her and said, "That is a hemangioma and she'll be just fine. Your daughter's gonna be okay." And for the first time in 48 hours, I think I was able to breathe again, Jennifer wrote on Facebook. As per the Cleveland Clinic, hemangioma is a type of growth that appear as red or purple lumps on the skin. They're made of rapidly dividing cells of blood vessel walls. It's a type of birthmark that can be present in babies at birth, as in Sloane's case. While hemangioma is a tumor, it's non-cancerous, isn't life-threatening, and doesn't spread to other body parts. The growths themselves can be removed without risk of reoccurring after surgery. Even so, complications can occur, including sores that lead to pain, scarring, or infection. Depending on where a hemangioma is situated, it may interfere with a child's vision, breathing, or hearing. In Sloane McGillis's case, it took up most of her left cheek, and one of the worries was that it might affect the muscles on the left side of her lips. She couldn't fully close her mouth and had to wear a bib all day to catch the drool. Doctors at the hospital suggested that Sloane's parents wait to see if the tumor shrank over time. At the time, Joe and Jennifer were worried about the reaction Sloane would face at school if the tumor wasn't removed. When Sloane McGillis was 8 years old, the decision was taken for her to have surgery. Her parents met with specialists around the U.S. and soon began working with Dr. Milton Weiner at the Vascular Birthmark Institute of New York. He is seen as one of the world's foremost experts in vascular anomalies. On January 6, 2016, Sloane was prepared for the procedure. On Sloane's Facebook page, Jennifer wrote about the very emotional day her daughter went under the knife. "I prayed that was not the last time I held her. They had a plan, but we knew we couldn't expect the entire tumor to be gone. And you can never mentally prepare yourself to see your baby cut all over their face with hundreds of sutures and tubes coming out of them. I look back on this first experience and my stomach goes in knots just thinking about the moment I held her in the operating room with a mask over her face and watched her eyes roll back in her head," Jennifer wrote. The procedure involved making incisions below Sloane's eye and along the side of her nose and mouth to open her cheek up. The doctors were able to remove 90% of the tumor. 1 week later, during a follow-up appointment, Dr. Weiner burned some of the blood vessels below her skin using laser treatment, helping her normal skin color to return. But Joe and Jennifer McGillis had one big problem despite the wildly successful procedure. It turned out that the hospital, Lenox Hill in New York, wouldn't accept Sloane's Montana Medicaid insurance, meaning that her daughter's surgeries would cost a fortune. Joe and Jennifer took to the internet to try and get help in raising the funds. A bank in Missoula set up a medical fund in Sloane's name, and an online fundraising effort brought in more than $30,000. Sloane McGillis' family was given more than $100,000 for medical costs. 3 months before the first surgery, Joe and Jennifer got word that the Hannah Storm Foundation had raised enough money to cover all Sloane's surgeries and hospital stays in New York. Their local Missouri community supported them massively, and the support was overwhelming for the parents. In total, the family was able to raise more than $100,000. Over the next year, Sloane underwent 9 more procedures, the 10th of which helped remove the scars from her face. The world has been able to follow Sloane's journey through her Facebook page, Sloane's Story, and over the years they've been given some special treats. The family met ESPN anchor Hannah Storm, the founder of the Hannah Storm Foundation, who donated money to Sloane. "I was born with a port wine birthmark stain on my face. Without makeup, even to this day, it looks like a black eye," Storm told Inside Edition. Jennifer called her daughter a miracle and was happy that Sloane has a chance at a better life. Sloane's inspirational story spread nationwide, and hundreds of people wrote positive comments on their Facebook page. She also received assistance from the Jade and Fred Foundation, where she was given a pony to add joy to her life during a difficult time. The years passed and Sloane grew up, got a dog, and made many friends. Today, the little girl has just turned 8, and she's living her best life. She has almost 5,000 followers on her Facebook and is learning how to play golf and baseball. In May 2021, her family attended their last checkup meeting at their office. By all accounts, he's become like an extra family member. In an emotional post, Jennifer described him as patient, kind, and generous. Despite removing the tumor, Sloane has been left with some issues. Her family were forced to once again return to Dr. Hardy, who was concerned that her tumor had produced proteins that made her orbital bone grow thicker in her cheek and eye socket. Based on the latest picture posted in April 27, 2023, Sloane is truly happy and busy enjoying life as any child should.